Hi, my name is Jenna Mathis and I'm a child life specialist. So my job here at the hospital is to make sure that your child is comfortable, that they understand what's happening to their body, and that they can have as much fun as they can while they're here. So there's some different ways that I do that. I do that by explaining procedures and their diagnosis to them in words that they can understand. I'll bring them lots of different activities and toys that they can play with so that they can engage in some different therapeutic and expressive activities to make sure that they're coping appropriately and understanding all the feelings that they're experiencing while they're here. And by allowing them to play and normalizing their environment by bringing them different things to do, it allows this whole experience to be a lot less threatening and scary for them as well. So one thing that I wanted to talk to you about today is comfort positioning. And if you don't know what comfort positioning is, comfort positions are positions which help promote the comfort of your child during different invasive procedures by incorporating you in these different comfort holds with your child. So these different holds are going to make your child a lot more comfortable, and you'll be able to provide them with support, both emotional and physical, during their procedures. So this way, we can complete the procedure much easier, much quicker, and it will also make the whole experience a lot less threatening and scary for your child. There's a few different goals during comfort positioning. These goals are having a secure hold during the procedure, having close physical contact with their caregiver or with you, incorporation of a sitting position or promoting a different sense of control for them, immobility of the extremity is successful, that the table does not move even if the child moves, and that fewer people are needed to complete the procedure, which is good, so yay! The first comfort position is the side sitting position, where the child will sit like this on your lap and their legs will hang over the side. We use this when the patient's unable to straddle you in the chest-to-chest position like this. Unfortunately, the side sitting position allows more mobility for your child to kick and move around in that chest-to-chest position. So we want to make sure that they're not moving and we're holding them very still to make sure that the procedure goes as quickly and as easily as possible. This is a good one because older children tend to feel more secure and less confined in this position. The second position is the two people hold for placement. So this position is utilized when the child prefers not to watch their procedure happening. So they'll sit in the chest-to-chest position like this and straddle you. And this is a great position to deter kicking or any movement from your child. And it's a great position to provide distraction or alternate focus for them so that they don't have to watch what's going on. So they will look away from the action as their procedure is being done. The third comfort position is the position to watch for an IV. So we'll take place in the chest-to-chest position again, except for your child will face the action as their procedure is being done. This position is really helpful for children with respiratory conditions as it allows them to breathe a little bit deeper, and it also allows for us to hold their arm more securely on the table as they're facing that arm. It also allows for you to hug your child and provide that emotional and physical support. Another comfort position is the team approach to an IV. This is when you're holding the child, but the arm is held by a nurse. The arm is supported by a folded sheet or a pillow. So we can do it this way, where they're sitting looking out from you, their arm is on the table, supported by a folded sheet or a pillow, while the nurse inserts the IV. Another comfort position is the injections in the leg position. This way, they'll straddle you while you're standing up and they're sitting on the treatment table, and their legs will bend over the treatment table, and this will allow for those leg muscles to relax and will make the procedure go a little bit smoother and a little easier. It also won't hurt them quite as much because their muscles will be relaxed. So this way, one person is able to easily hold the legs securely on the table while the other injects the IV or whatever procedure might be being done. And if kicking occurs, it's only happening from the knee down. This position can be used for holding a child in the lap of the caregiver or on the table, like I said earlier. Another comfort position is a one-person hold for IV placement. This is good if you feel comfortable holding your child and you don't need as much help from staff. So you can sit them in the side sitting position like this. Their arm will go on the treatment table. You wrap your arm around them and grab their arm, and then it gives your other hand the opportunity to hold their hand during the procedure while the nurse does the procedure or inserts the IV. Another comfort position is when we'll do an IV placement in the foot, where the nurse will grab the left foot, the one that's not having an IV or any procedures done on it, and they'll also grab the other foot by the upper part of the leg, and that hand will hold the foot for the IV placement still. During this position, it's important for you to hold your child and hug them, even hold their hands if necessary to keep them calm. So those are some of the most common comfort positions that you might be able to do while you're taking your child to the doctor or to the hospital for their next visit. I really hope that this video can help you in the future for your child's upcoming procedures and making them more comfortable and making the whole thing go a lot easier and quicker for the both of you.